Hello everyone, I am Dr. Kalpana Suresh, Medical Director and Chief Ophthalmic Surgeon, Kalpana Eye Care Hospital, Chennai. A 35-year-old IT professional came with history of seeing many tiny particles floating inside his left eye all of a sudden while working out in a gym. He felt his vision was partially obscured. He was wearing spectacles with a power of -13. Eye floaters appear as small spots that float inside your eye. They may stand out when you look at something bright like white paper or a blue sky and tend to move away when you try to focus on them. They might annoy you, but they are usually will not interfere with your vision. They come in many different shapes: dots, lines, thread-like strands, cobwebs or rings. What causes them? Commonest cause is age-related eye changes. As you age, the vitreous or jelly-like substance filling your eyeball and helping them to maintain their round shape changes. Over time, the vitreous partially liquefies, a process that causes it to pull away from the eyeball's interior surface, that is retina. As the vitreous shrinks and sags, it clumps and gets stringy. This debris blocks some of the light passing through the eye, casting tiny shadows on your retina that are seen as floaters. There are some serious eye disorders associated with floaters, which include: first one is inflammation in the back of the eye called posterior uveitis. This releases inflammatory debris into the vitreous that are seen as floaters. Number two is bleeding inside the eye into the vitreous. This can be due to uncontrolled diabetes, hypertension, blocked blood vessels and injury. In this, blood cells are seen as floaters. Number three is torn retina. Retinal tears can occur in a person with high myopia, that is, who is wearing high minus power lenses. Without treatment, the retinal tear may lead to retinal detachment and can cause permanent vision loss. Number four is eye surgeries and eye medications. Certain medications that are injected into the vitreous can cause air bubbles to form. These bubbles are seen as shadows until your eye absorbs them. Certain vitreoretinal surgeries add silicone oil bubbles into the vitreous that can also be seen as floaters. And number five, rarely eye tumors. Tumor cells can also cause floaters. So when to see the doctor? If you have only few eye floaters that do not change over time, it's harmless. Consult an eye doctor as soon as possible if you notice a sudden increase in the number of floaters, seeing some flashes of light along with floaters, and if you are wearing high minus power spectacles, loss of side vision, that is, straight vision will be normal, they will not be able to see this little part of side vision. If it happens, you better consult eye doctor. And also changes that come quickly and get worse over time. Floaters after eye surgery or eye injury, and if it is associated with eye pain. So in case if you have these symptoms, your eye doctor will conduct a complete eye examination, dilating the eye to see the back of the eye called retina and vitreous to determine the cause of the floaters. How are floaters treated? Any underlying cause of floaters such as bleeding from diabetes or inflammation will be treated. However, most eye floaters do not require treatment. Eye floaters can be frustrating and adjusting to them can take time. Once you know the floaters will not cause any more problems, you may eventually be able to ignore them or notice them less often. The patient which I mentioned earlier was found to have retinal tear and retinal detachment. He underwent surgery for the same as an emergency procedure. His vision was restored and floaters disappeared. Hope all the queries about eye floaters are answered. Thank you. Have a wonderful day.